utility, you'll still go to the Practice Partner Support website and save it to the PPART folder, and then you're going to go ahead and run that utility from the command prompt to make that switch information that comes on. So the utility then, once you run it from command prompt window, it'll go ahead and tell you whether it's completed successfully or failed. So that is the first utility information. And again, if you have patient records, this isn't what you're going to do on that. We also have some, with your test systems, if you have test systems that you usually go ahead and install the information on, this is a utility you will use. There's going to be more information coming out on that. Keep in mind with the test systems, you won't be able to download Enterprise RX on that because of the registration and all the things that go into it with the clearinghouse and information, but we're working on using that utility to be able to go ahead and install that information on a test environment to give you to keep that updated information as it goes through. So there will be more information coming out on that. With medical billing 11.2, what you're going to see on the changes is there's increased character limits for names up to 35 characters, information that is in right there. So that's the difference that you'll see with the medical billing 11.2 information. And that would go whether you've got total practice partner or just your medical billing. All right, sites with patient records, and this would include our practice partner, Metasoft, Lytec, anybody that's using information from this will be included on this. So the sites that use patient records must complete specific steps to upgrade their patching systems 11.2 and to upgrade then on into Enterprise RX. Do not follow the steps for new patching system utilities. So that's what I just went through a minute ago. So when you go to install this, do not follow or do not utilize this. And keep in mind, we have all of our guides and everything to come through for you on this. This isn't going to be the only information you have on doing that install. During the patch session, the process practice partner patching utility, you'll want to make sure also that you elect the appropriate interface and add on patches to upgrade them to 11.2 as well. Also upgrading to 11.2, here's the action information that you're going to do. So some of the install will be the same as it's always been, but once you get with the Enterprise, then that changes things and extra steps to be able to go through on that. And then as always with any kind of install, we always have to finish information once everything's installed and get back into Practice Partner on the admin side. Okay, so this is the checklist that I was talking about. And I'll have this available for you, I've broken it down into different sections prior to the upgrade. We'll just go ahead and start there. So the first thing that you want to do, and you can even start doing it right now, even if you're not going to upgrade till later on, which that's where we're at right now until it gets out to GA. But the first thing is you're going to want to verify all prescribing providers are enrolled with SureScripts. So in other words, when the providers you have in your database, that they are enrolled with SureScripts, and then you want to look at the data that is currently enrolled in SureScripts on Practice Partner Support site, all that information there. You want to make sure that that information matches up to what you have in patient records, in Practice Partner Provider Setup. And the purpose of that, you'll see as we go through the migration, is that in order to work through that whole process and be able to get installed and have all your providers ready to roll with E-Prescribing and Enterprise, is that all that information has to match up. So that's what we're asking is to go ahead and do that now, and you can do it now or you can do it prior to installs, the best I can explain to you, to be able to get that done. And because what will happen is if there's things that are not reconciled when we go to do the install, there is what we call it's a migration, but there's a window that comes up that is going to require you to reconcile that information. And you can't get past it till you reconcile. So the more that you have this done and prepared for, the less you're going to have once that information pulls through and you get to that level of the migration. EPCS registration is encouraged if prescribed and controlled medications. Now, a lot of people are already signed up on that, which is great, and it'll go ahead and migrate over there. But if you have a provider or you're in a position where we're like, well, we're thinking we might go ahead and do that, now is a good time to get that done. Again, because once you go into Enterprise and we bring everything over, if you're not enrolled in EPCS, then you get to go through that ID proofing at that level. You'll just have to do it again. But it would already be done for you once you migrate. So it's just a time to think about it. And I think that there's some costs involved in that, but so that's not what I do on that part of it. I'm not going to, I don't know what it would be or anything, but it's just recommended that if this is something you plan on doing or you think you might want to do, it's a good time to go ahead and start getting that process done before you get enrolled over into the enterprise. Clean up the current operators to have active only. I said this on the FDOC side of it too, is because the operators come over, but in this case, if you have a lot of operators that are in the system and they have access levels and they're no longer there, technically they should have already been made inactive, but it might be something to look at. Because again, with your operators, with this comes, once we get installed, you have to link your operators, which would be operators that give access to process medications, to the prescribers, which would be the providers. So more or less, if you have it cleaned up before you migrate, then you don't have to worry about that afterwards. Collaborate internally on new workflows and responsibilities for each staff member. So this is a good thing as well, too. Of course, that would come with training, pre-installation, that kind of stuff on there, but they really need to understand what it is that they're going to be doing when they're moving, because once you install, it's going to be like walking in the door, and it's going to be a whole new Windows and everything moving on to that. So that'll be important to have that done before, and not migrate somebody and expect them to come in the next day and start writing scripts because they'll be lost. Consider reducing your schedule on the first couple of days to allow time for workflows. That's always a good thing with a new installation, just because. And then there will be Engage videos and webinars on Enterprise RX. And as I said earlier, the Engage videos are in the process to be getting out and will be all done very shortly. And then the webinars, I'll continue on the Lunch and Learns, recorded Lunch and Learns. And this one as well is recorded today as well. So you'll be receiving this as it gets completed too. So I'll continue with these, and we're going to probably have extra ones for you all to go ahead and work through as we're moving to and getting everybody migrated. Again, prior to the upgrade, review practice partner documentation. We're going to have the 11.2 release notes available, and then you will also have upgrade and configuration guide as well. This checklist will be on there, and a quick start type information as well. So there'll be more information to come and available to you as needed. Also, because of the enterprise, it requires on your security internet to go ahead, you can add these two links, URLs inside of the internet security window, because that's what launches all those windows to go ahead and come out. So you want to have those set up prior to, so that once it's done, you don't have any problems there. We also, we will have training, purchase training, that if it's something that you feel like you want to do or need, you can reach out and purchase time on that, and it could go by the hour, whatever works on that. So you also, that is also going to be available. And then also on your WebView, most of us are still on WebView. So what you're going to want to do is that at least 1 week before upgrading to 11.2, you're going to want to email WebView setup at this link right here and let them know that this is the date that you're looking at going ahead and upgrading, about a week ahead of that, because there's they need to get things set up as well on that, because WebView is an add-on information that comes on. So you're going to want to make sure and have that on your checklist to make sure that gets done for them. And you'll see also post-upgrade, you're going to want it, once you get upgraded, then you'll want to send them another email telling them that you have completed that. So there's things they have to do in the background there. Okay, so this, I kind of separated this out to database preparation, only because with Partner, there's a lot of little bits and pieces running around that things that you got to put together on that. But this is, again, starting off to validate provider information in provider maintenance to information on SureScripts. I already mentioned that before. It's on this checklist again, but that is an important one as we move through. So it's just going to be there to make sure that that gets done prior to that. Providers are associated with the correct practice and records too of the practice maintenance. That most of them are set up that way, but on E-Prescribing, you just want to make sure that they're associated with the right practice. Again, when we do the migration and we transfer the data through that install, it looks at, you migrate your practice information, it looks at the providers who are set up in there and brings that over into it. as we once knew it in that records 2, we would go in and enter data, and we'd enter in our SureScripts ID once we obtained it from SureScripts. Once we go to Enterprise, that information becomes hard-coded, and I don't know if I want to even use that word. Basically, we will no longer manually enter in those SureScript ID into that window on that. So you want to make sure that everything's the way it needs to be before the migration, and afterwards, when you add new providers, that kind of process, then that will change. If you won't obtain that manually anymore, it's actually going to be registered through your EHR and come back into that data. So just something to look at. Pharmacy table. So for the last many years, we've been downloading our pharmacies, and then when 11.0 came along, then we downloaded, didn't have as much, we weren't having to manually enter pharmacies, or you could still do it. But when I say custom pharmacy information on that, this is if your site, or if you have certain kind of pharmacies that you use that you'd set up and they were specific to whatever it is that you needed, certain kind of data on that. This pharmacy information will migrate into Partner. It also will, the pharmacies that are associated to the patients inside of the patient demographic window will migrate over information that comes into it. But if there's any kind of information on that, you want to make sure that you look at it and take note of information that pulls onto it, that pulls in. If it's not there, I think it'd be just something that is maybe real specific that you're using, but just kind of keep that in mind. And if it's something that your site's using, to kind of take a look at it and see if you need to take note for that. And when I say custom pharmacy, it is equal to the user added in current 11.1. So if you recall, when we updated to 11.0, previously we could we entered our own pharmacies and all that kind of stuff, information pulled onto it. That's what that is related to on the custom pharmacy. Make sure all the refill requests in the inboxes are processed and cleared. What happens here is and you can do this, I mean, if they're going to go ahead and upgrade, hopefully they've been using that function. If they have not, those can be archived at some point. But what will happen is if there are refill requests inside the inbox that are just sitting there, once we migrate, they still are there, but they're dead, meaning that they can't go in and forward on or do whatever they need to. They'd have to then move them in, because all of that workflow is going to be moved, will start being processed through the work list. So that's just something else to be able to kind of get done and make sure that that's being processed and updated so that you're not far behind it or you're missing anything that comes to it. I just added the Run ACI Performance Metric Report, again, depending on what time or anything else that you're going to go ahead and migrate. It's just, I mean, you can just have it in there, information that pulls onto it. Better to have it than not if you need it. And then for your database, for your C-Tree sites, run your ctgui.exe to make sure that check database is clean. Next is update on all patches. You'll hear this several times through this presentation. So there again, patches must be updated. Like we talked about with going to UpDocs, you got to be updated on patches. With this one, you've got to be updated on patches. So make sure that that is done prior to thinking about install. And then last but not least is a site must be activated with Clearinghouse to install. So you've got to make sure that everything's activated. You might be in the process of getting somebody signed up, that kind of thing there. So that's where you want to make sure, because again, through this activation and once everything goes, the purpose of the install is to make it easier and have everybody grandfather in and move into Enterprise versus having to redo it and go through the ID proofing or whatever that needs to be onto it. So moving on to the next part of the checklist is to complete all pending prescriptions and refills. I just said that information that goes through. Verify all notes with medications prescribed are completed and signed off on the day of there if you're using the .rx or information that comes onto this. Print and have accessible enterprise documents just for staff. Have an administrator available to do the transfer of data for practices during the installation. And I've got this documented later on, because this is really where that whole process comes through, is once through the install, you'll want somebody on site that can go ahead and do that reconciliation of the data for the practices, the providers, and then the pharmacy information that comes on. So there's just a section of that needs to be done. And as I said, if there's anything that isn't reconciled in there, then it's going to force you to get it done before you can complete the install. And then go live day, have basically your administrator needs to be able to update all new access levels, be able to just go into prescriber management, check out everything, make sure everything's ready to roll, link your operators to your prescribing agents in provider maintenance. And when I say that is in enterprise, no longer is there, previously knew it that our nursing staff could come in, they would have access to process medications. You might or might not have had it set up to require a signature for prescriptions. With enterprise, that process goes away. It isn't required that anything gets signed on the medications like what we currently, you may or may not have that setting, which ties back into the PR utils. With link operators to prescribing agents, what it is prescribing agents equals your provider setup and the provider maintenance, and then operators would be your operator staff who has access levels to be able to process medications. And I'll go through that and show you where that linked up, and that would definitely be something that has to be done after the migration. Have a backup paper RX handy. That's just kind of one of those things, you just have it just in case. And then there again is that documentation for your web view. Once it's installed, to go ahead and email them and let them know that it's installed, and that they can go ahead and finish doing what they're doing on the background for the binary information as well. Because as I said during UpDocs, just because you go to 11.2 on the 2015 certification version doesn't mean that you have to drop WebView right away. So that's why you want to make sure that that gets set up if you're still on WebView. All right, so here's some different administrative tasks to think about and have on your list. Is when you go to do install, all users need to be logged off of all practice partner applications. You basically, or you must, I'm going to say, make a full cold backup system snapshot, including the operating system of your practice partner application server. This backup should include everything you need to recreate a production environment. It just needs to be done, information on that. So if anything, you've got it, and you can always go back to utilize that if needed. And do not continue the conversion until the backup is complete and verified, and then restart your server before installation. Sites running the PMSI monitor service only. Stop the service before upgrading. Once the upgrade is complete, you must restart the PMSI monitor service. And I will go ahead and repeat this, as this information will be in the guides that you have on that, so it's not something that I'm just throwing out at you that you have to remember. It will be in those guides for you to use. All right, so if your site also has add-on products or interfaces, you must upgrade these products. Current versions will no longer work after you install 11.2, so you've got to think about all of your add-ons, think about what it is that needs to be updated. Don't install 11.1 add-on products or interfaces before starting the 11.2 upgrade process. And then during the patch selection process in the practice partner patching utility, make sure that you select the appropriate interface and add-on patches to upgrade them to 11.2. And then this is just, again, you've got your web view information on there, and then custom interfaces. If you organize and use any of the custom interfaces, and you're going to go ahead and upgrade, you need to contact support on that, and please allow 30 days in advance lead time when you do that. So there again, if you're going to go ahead and upgrade, you want to make sure that you understand all the bits and pieces that are involved with the EHR and be able to reach out and get that information that's needed. All right, let's just go ahead and start moving into the enterprise migration and the step-by-step process on that. So you'll log into Practice Partner website, and you'll download the Migrate to Enterprise RX.exe utility. That is that utility, the information that comes on. And you're going to go ahead and put it into your PPART folder. You're going to have a checklist that comes up that's kind of similar to a lot of that stuff that I've already gone over, information that pulls onto it, that goes through to be able to say yes and move from that information that pulls through. So it's just a task information pulls on. But once you double click on that executable, this window is going to show up, Migrate to Enterprise RX. It's going to default to the Migrate Enterprise Prescribing. If you look right below that, it says rollback. A failed migration will not be available if migration succeeds. So in other words, if everything's cool, it goes through, you won't need that. But it is there available for you in case when you go, if something happens prior to installing these patches, which you'll see in a minute, you can always come back and roll back and start it over again for whatever reason if there's errors coming onto that. And then below, you're going to answer those questions again. If you've backed up, if you have processed pending refill requests, and then I'm running this process over the weekend, since the database conversion could take up to 2 days or longer. So you're just going to go ahead and click those, and then I am up to date on patches. So you're going to go ahead and it's going to force you to go ahead and answer those questions, information that pulls on. And as I said earlier, if it failed to complete, then you'll have the ability to go back in there and then roll back the migration. And what happens there is it basically is going to roll back and allow you to go ahead and go back into 11.1 and allow you to electronic e-prescribe as we've known it up to once you migrate. So that is just allowing you to go in and get that done. So let's say everything is just totally perfect in our practice partner world and we just migrate on to the next window. If everything goes good, it's going to go ahead and launch this software update and set to download the enterprise, the install, and you'll just click OK to move through it. This is where the patches show up, these new patches after that. You still need to be updated to date on current patches coming out. Once you get into this, you're going to have, this is getting that new patch for the enterprise patch. Keep in mind, once you get to this level and you download the patches, there will not be any rollback option. That's where that big backup would have to come into play if something else went beyond that. So you'll want to go ahead and upload all those patches. Once the patches are installed, you successfully, then you're going to go ahead and open up Practice Partner. And you're going to have to activate the Enterprise RX. And where that's found is under the maintenance window in external systems. You'll open it up and you'll see an activation key at the very bottom inside of the external systems. And you're just going to go ahead and edit it. And you're going to click activate. And this information then will start populating. It's activating all that information into there to be able to make it run. So information will fill into it. If the activation does not complete or there's an issue, at that point, stop and contact support so we can get on there and get you help that's needed, information that pulls onto it. So once that's done, then you can go ahead and go back out of Practice Partner, because then the next step is you're going to go ahead and run, go back into the P part and run this register with enterprise rx.exe. This is going to go ahead and open it, and this is where the process of transferring the data and migration of all the data that's going to come through is going to happen. If you're not using e-prescribing or are a new customer, you don't have to worry about this because you don't have data pushing, you're not going to have the data going back and forth. You don't have prescribers and that kind of information that goes through. So it's going to be, but if you're e-prescribing, this is the next step to be able to go on to it, which is going to be the majority of us. So once you open up that executable file, it's going to go ahead and open up a register customer. Over on the left side, you see information come in. You're going to click next. And then this next window with register with Enterprise RX is going to open. And what this is this is starting to take the data and push it down back to Acme and then be able to start talking between the systems, I guess is the best word I can put onto it. So you're going to go ahead and click that match SureScripts providers and practices. So what this is going to do is going to take us through a process of being able to reconcile all this data. And once it's done, then it'll go ahead and that data is going to be reconciled in not only Practice Partner, it will be reconciled from SureScripts to Practice Partner. So this kind of comes back into the checklist where I kind of said like 2 or 3 times probably, go through and start matching up that information, because when you get to this step, if you haven't done that and you have stuff in there that isn't going to fly, this is where you're going to spend a lot of time and frustration to be able to get that information fixed and be able to resolve it. So if you've already done it, that may not be so bad. If there's no information on that, you'll fly through this if there's nothing to reconcile. So I'm going to go ahead and once at this point, you're going to just match the SureScripts, and so it's going to start with going in and matching the practices. So the practice information that's set up, it comes into this. If there is nothing to reconcile, if everything is cool, everything in Practice Partner reconciles with what isn't registered in SureScripts, this window will be empty. If it's not empty, then you're going to have the practice of information in here of what needs to be reconciled information that comes into this. So I only have one in there. We've got practices out there with many practice information on that. So it just depends on what's in there to be able to come back on it. So once this window opens up, you're going to hit the reconcile button that's right here on the window, and it's going to open up this reconciliation for practices. And so what you see on the left side is what is associated with SureScripts. What you see on the right side is what's pulling out a partner. And so the goal is to take this information here and reconcile with what is in partner, so that once you're done, that information all matches up. And then once you get it completed, you can save and close right down below, and then it's going to go ahead and update that information as it pulls through. So once you get through all of your practices, that window will clear out. So, if I've reconciled, it's going to go ahead and clear out. Then you'll go back into this window. The next option is going to open up for the prescribers. And so that terminology now, prescribers equals providers. That's where that information is pulling from that. So the next thing is the step is still the same thing. If this window has data in it and providers, that means that it's not matching up to what SureScripts has in it. So you would have to work through that same process again to make sure that the information SureScripts has on file then is pushed over into the partner side, because once we finish the install, that information then is going to go back into Practice Partner and update that information. It's not something you're going to have to go back into Partner to do, but that's what it's trying to do. And if it doesn't get done in this process, it's going to stop you. So as I'm saying here is if there's any issues with the data reconciliation, they must be resolved before continuing this next step. So that's, again, better prepared and be able to get that done than not, but it will go ahead and give you information in here of that information. If everything's good, we're going to go ahead and hit next. And the next step is going to be register organizations for Enterprise with RX. Information that comes on. This window is basically going to go ahead and display the total number of providers who you have affiliated with practices in Practice Partner, and the number of providers who need to be migrated to Enterprise. So that once you've got through the reconciliation, this next window is going to go ahead and get it registered, and then you'll come down here and click the Migrate Prescriber information. Once that information is done, you're going to have a window that just comes up and says how many providers were migrated, and if number of prescribers needing migrated could be information that pulls through, and any information that shows up to that. So, I mean, that's just data I'm showing in that information there, but it's going to go ahead and document what's needed to pull through. All right. So once you get through all of that, then it's going to go ahead and the next step is to migrate the pharmacy migration. So the pharmacies will be your custom pharmacies as well as it's going to reach back into the pharmacies that are set up into the patient's demographic set and their pharmacies that are set up in there, and that's what's going to migrate that information into it. So from here, it's just going to tell you what you've got to do, and then you're going to hit Migrate Pharmacies. And then this information will go ahead and pull in and tell you what it's done and completed. And then you can go ahead and hit close on that. And then it'll go ahead and give you a migration activity report that'll show up when it's in. You can close that. You will also be able to go to the register with enterpriserx.log file information that's also going to give you a log information. Okay, so sounds pretty easy, right? I'm going to put it this way, is that going through this, I look at that and I'm like, okay, we can do this, move through to it. There's a lot of information going on. As they install, we will have more sessions going out, and you will have guidelines and guides and all that kind of stuff as well to work through this. So as I start pumping information into your head, keep in mind that there is backup coming on. All right, so migration goes through, everything gets upgraded, and once you get to the process of the pharmacies, everything else, you would be finished. And at that point, then you could go ahead and you should have access to Enterprise. You'll be able to open up Practice Partner and start on certain tasks of information that needs to be done. So the first thing is start with your access levels, because we have new ones, and you want to make sure those are set up and so that because if they're not set up properly, then when you go to link your operators with your prescribing agents to become prescribing agents, you won't see them in that window. So what you see here are some removed access levels. You can see that the electronic RX signature and all that little section that was in the access levels are now gone. What does come back in is our RX medications under the in the maintenance setup under the records tab. This information on the very top, that is already there. And so depending on what that was set up, but this is what dictates what, and as well as the enterprise below, it dictates whether that operator can be seen inside of the operator and the prescribing agent window. So you'll want to go through and set and make sure that whoever has the need, or that's their job to be able to do, and they need that access level to be able to get that set up and make sure these are all set up in order to go ahead and be able to the next step to be able to link those, and then when the users come to work, they can go ahead and log in. We also have the new ones down below. It's in the same records tab. It's called Enterprise RX. You'll just scroll a little bit further down and modify and adjust. So this information is there as well that you're going to want to go ahead and get set up. You've got your MDs, your nurses, and any other types of access levels that would need to be able to get in there. You're going to want to go in and get those set up post the install. The next new one is going to be the ERX work list access. So you'll want to go in, it's still on the records tab under the patient chart section. You'll want to go ahead and give that person, whoever's going to process medications, they need access to this, because that is where the new workflow is going to be for receiving refill requests, changes, adjusts, and all that kind of stuff on that to be able to, information that goes in, that will want to be updated to give them the ability to open that up. And then the patient pharmacy is just changed. You won't, it's going to go ahead, if they had access before, it's going to go ahead and be there, but we removed the new and delete options on there. So because of the new way the pharmacy management comes into that. So that'll be, that's just changed. And then the other one is going to be prescriber management. This is more of an admin access, but that prescriber management who has access to that will receive just different information that comes onto it. And so whoever would need to go in and manage prescriber management, it's a new screen, and that's kind of where I mentioned earlier when we migrated the practices and the providers, that information all gets registered at Enterprise, and then it's going to come into Practice Partner, and that's where that new management of prescribers is going to be. So somebody, you make sure that somebody's got access to be able to get into that. It's an admin, but that is also, that's going to be found under your general tab under maintenance and setup. Okay. Next is to link the providers and the prescribing agents. So you're going to want to go ahead, and once that access level is all set up, then you'll want to go into your maintenance and your provider setup. You're going to have to link each individual prescribing provider to agents. So that's the important of getting the access levels up to that, and you'll go through each one of these providers. Each one of the list of the providers who's going to go ahead and be prescribing and utilizing this. So you'll go ahead and highlight and hit edit and start down your list. You're going to go to Records tab, and you have a new button called RX Agents. You're going to launch that, and this window is going to open up right here. Now, you can see on my left-hand side, these are all my operators who have access to be able to process medications, what I just talked about, like in the RX screen. If you have somebody that you want to link to this particular provider and they don't exist in this list, the problem is they do not have access. So it's important that, that you get that set up, but to also understand if somebody's not there, then they didn't have the access. This kind of workflow will be ongoing from now on, because as we get new people coming in, new employees coming on, new employees leaving, you'll constantly be going in there and managing that information as it goes through. So it just kind of comes hand in hand. So in this particular case, you have the arrows. And if I'm linking all my operators to become prescribing agents for Wayne Best, okay? So then that's what I'm saying is you go through each one of your providers and you'll link up. Yes, other providers can be prescribing agents. So whoever I want from this list over here to be able to go in and write prescriptions, for this provider, or I'm going to say process prescriptions for that particular provider, you have that's where you would go ahead and link them into it. But they have to be, you have to do this, because if not, Enterprise, then if you went in to try to write a prescription and you didn't have access to this, it's not going to let you do anything. It's going to tell you that you can't do it. So this is important to be able to get that set up information to pull on. And then the next is, once you kind of get that information going through, then you would go ahead and go into your medication window and click New. And this is where this is indicating that my prescription medication window is going to go ahead and launch, and telling me that it's launching, and I'm good on that as far as it goes. Allergy to do the same thing. It's going to go ahead and launch this window, as well as even the work list, to be able to go in and open that information up to it. So today, again, we only got an hour, and that's why I want to, as we start going on the next Lunch and Learns, I'll start doing some deep dive into the individual windows and information that loves. I'm going to tell you guys, you're going to love this information that pulls in, because once this window comes in and what you're looking at, it's replacing the script writer we see now with the templates, and it allows things to move through. You can move to different windows. You can add pharmacies on the fly. It's great. But that information that shows up. The other window that you're seeing in here is that the favorites windows, so you'll be able to go in and add favorites. They are user defined at this point right now. So if I log in and I add favorites to my window, it's going to be specific to me. So every time I log in, whether it's at the work list level or if it's at the enterprise or at the medication window, those favorites are mine. If Dr. B comes in and he logs in, he's going to have his own favorites as well. So one of the things is that once you get updated, if you have certain things that, well, maybe there were certain prescriptions that somebody had set up specifically in what we have now, 11.1, you could take that time, if you wanted to take that time and get these prescriptions set up in here as their favorites but they would be specific to them. So just kind of keep that in mind, but it's something that they could go in and get that information, because you have the ability to go in and set favorites. I could have 5 different types of amoxicillin set up with different kinds of signatures that's needed that would always just be there for me to be able to use. So it's a pretty good workflow information that comes on, but just to kind of get you start thinking on that, and we'll work on that as we come through to work further and understand that better. All right, so I'm going to go ahead and move to prescriber management, because I've said this a few times of information that comes on, and you would have to have, somebody has to have access to be able to get on there, more of an admin, but this window opens up. So now, when we went through the migration and we did the providers to the practices, your providers are set up, that data is matched up with what's in SureScripts. The purpose of this whole thing is so that your existing providers, before the migration, they come into this and they're set up already. They've already got a SureScript ID. All that information should be ready to go. So there shouldn't be a lot of have to work on that information that pulls in. As I said earlier, if you're somebody that you're thinking about maybe starting to write scheduled medications, if you did it beforehand, then once we migrated, all of that stuff would go ahead and be done on that and wouldn't have to be through that process. We'll work more of this on times coming, as well as the ID proofing. But once you bring on new providers and you've moved to enterprise, the ID proofing or the EPCS comes into play. So basically, before we'd go to SureScripts website, we would log people, or we'd get people registered to write medications and use just the E-Prescribing. Now with the ID proofing information, it'll go all through this window. So the days of having to go back to the support site will end with being able to manage all these prescribers through this window. So this information, then again, it looks at the information back that's in your practice maintenance, pulls that information in, and then this is where that data will work. What you're seeing is really kind of a print screen out of our test systems, but once you migrate, you should be able to come in and everyone should have their SureScript IDs and be able to roll on that and to be able to start writing scripts, because everything's registered in the background. All right, remove functionality. I've just documented some. It's also going to be documented in the guide, but one of the things I wanted to bring forth is the dose advisor screen and the dose calculator screen. Both of those have been removed with this release of 11.2, and recommended dosage based on height, weight, age, sex no longer occurs. But the functionality is going to return. So we'll be getting it back in there, information that goes through. I don't have a lot of answers on that. I mean, it's just documented as to where that's coming into it, but I wanted you to be aware of that when you first get started. Also, the print to send method no longer provides a remote printer option. All printed prescriptions will now be sent to a local printer. So keep that in mind. And then the confirmed discontinuation screen, you still have it. It's a different window that opens up to discontinue the medication information that comes from that we're used to seeing. Also, prescriber templates. So your templates that you've had all along, maybe for a really long time, will no longer be there because we're going to use that prescribed medication window. So as I said earlier, is that if you want to have some favorite information, we can print that your prescription window, and you can go through that and be able to bring those back onto it and add your signatures and all that information, but those are gone because of now the new functionality that comes onto it. The template functionality, again, becomes make a favorite, and you can make your favorite information to be able to use. And then instead of detailed templates, Enterprise comes with commonly used SIGs already built in. So right now, we have our templates that come in, and they may have defaulted type, frequency, take fields, all that kind of stuff. With Enterprise, those defined fields go away. It becomes an extended SIG information that pulls onto it. So there's going to be built-in information. You can always create your own. They make it as a favorite, and like I said, you could have multiple versions of one type of medication with different kinds of signatures that you can use right from your favorite. And then last but not least, you no longer will have to install Clinical Tools quarterly updates. So when we came out with 11.0, there was a lot of confusion on that NDC number, and then changing things, and then having problems being able to write those prescriptions. And the answer was kind of downloading the Clinical Tools and bringing in the new templates and removing the old. That is no longer going to be anything involved in that when the new one comes on. So with the prescriptions there, again, if you've got somebody that has done a lot of custom work in their prescriptions and it's what they use ongoing, you can print it. If you can print it to file, you know, it could be pretty long on that depending on how many times they have it, but you do have an option. And then if you had note on that, once you went to Enterprise, you could go ahead and bring those in fairly easily to that favorite list, and then they would go ahead and have it. So as I said, with the new functionality, you've got your favorites. You log it in, but there again, they're going to be specific to end user. That is going to, I think at some point we're going to have clinic favorites to come into it. Your favorites are all saved right in that prescribed medication window up through the A through Z information that pulls on. So as they get many of them, they can click on the little letter of the alphabet, and it's going to go ahead and just narrow that search down information that pulls onto it. And then your dose and your signature now will be in the form of it's not going to be a take field and a frequency field like we had before. In a form, it's all going to be signature information that pulls on. Right. So with your prescribing, your prescription defaults, a lot of that has gone away. Enterprise will replace all of that. So before we go in and we'd have all of our defaults set up, what you will still have in that prescription default is the one window that says print the RX onto the note. So we had that before. Basically, when you wrote the prescription, if you had that checked, when you were done and you saved your note, it would document what RXs were written during that encounter with that note. That option is still there, and it's going to come defaulted set up, but Enterprise takes care of all of this stuff. So you will no longer see that information pulling in, and interactions will be indicated just like I'm showing right in here in this window in a script of information that comes on with your interactions. Pharmacy management is really one of the, makes me excited anyway. The pharmacy window that we all know and love right now is going to be gone. It's going to be replaced with this window that you're seeing here. You still have search options. And through the maintenance window or through the table window right now where we just get the whole table of pharmacies, right now, once you transfer over, you're going to open up, you're going to have a choice of clinic. So you can change, you can have clinic pharmacies specific to the clinic, which could be some of those custom pharmacies that we talked about earlier, and they can also be saved as you go. And then you're going to have the SureScript directory, so that would be the whole directory. We have information that pulls on. So it makes it kind of nice to be able to have the clinic. And this information then comes in. You can choose those. Over to the right, you see the green pills and the orange pills. They look like paper clips to me, but they're supposed to be pills. So the green indicates whether it's EPCS and regular script writing and receive information that goes through. In the live data, you can hover your mouse over there. It's going to tell you exactly what is behind that. And then the orange is limited to not be an EPCS information or limited to other reasons on that. So that's going to show you there. And then this little edit box will allow you to take pharmacies. So like right now in Partner, if we wanted to nickname something, we can nickname that and then do a search by nickname. This allows you to edit it and nickname it, and basically what it does, it'll put you into your clinic list by that nickname information that comes onto it. So it makes it pretty sweet to be able to go through there and manage that very much easier than what we had in the past. No more downloads of pharmacies. All right, the migration window that comes in are the information that comes over for the patients in the pharmacy. That, again, through that migration process, brings those pharmacies in and to the patient's demographics. The Manage view will open up the pharmacy management window that we just looked at, and it's going to be specific to the pharmacies that are in this window. Very easy to switch out and change, remove, all that kind of streamlined stuff that is going to be able to manage the patient, and you can do it from the window you can do it from any window in Enterprise. So that's one thing that I see on there, is that you can kind of do a lot of work without having to go out and come back in right from this. And then the view of the pharmacies is pretty much the same that we've seen before, but it's hard-coded on there. I've seen where you could go in and put a phone number or something on there if you needed to view information on that, but that hasn't changed too much as far as what's behind that. Okay, a lot of information that I just talk really fast, and there you go. You will get a recorded of the slide deck. If you want just a hard thing slide deck, you don't get it, shoot me an email. It's on the front of this, and I'll go ahead and send that to you over if you just want it without any recording on that. As I mentioned earlier, I'm going to go ahead and go through a little bit of the MIPS information that comes on, and then on March 6th, the Lunch and Learn, we'll go through all the requirements, information that pulls in. You have reports already in there to be able to use this. But for 2019, the 2015 edition CERT is required for for your reporting of your PI information. So you, again, for this year, it's gone down to 4 objectives. I'll show you that in a minute. And then it has to be for continuous days or more in 2019, but it has to be on that 2015 certification information that pulls through, which you'll have that ability very shortly in the first part of this year. So this is if you weren't aware of them, this is the new 4 objectives for the MIPS reporting. You can see that it's gone down from where we were last year. Your E-Prescribing comes in, you get 10 points on that, and then you get a bonus if you're querying the prescription for drug monitoring program, which with the Enterprise you'll be able, and then as well as, or if you're doing it right now, which doesn't, with 2019, you want to be on the certification, so you'll already be on Enterprise, but you do have that option now if you're doing EPCS through Doctors First. And then verify opiate treatment agreement, so you get extra points on that. Your health information exchange is going to support electronic referral loops by sending health information, and then incorporating health information back in, 20 points on each of those. This is your direct messaging, and then this is going to be your bringing information back into it as well. That is listed inside of your CQM, not your CQM, sorry, your meaningful use guidelines right now for the ACI information. And then your provider exchange, provide electronic access to their health information is, again, having access to a patient portal, and then you've got some health registries. So we don't have what we had before. This is the new requirement, narrowing down. CQMs I don't think have changed too much, but there are going to be new guidelines to CQM in 2019. Make sure whatever vendor you're using, I know with BigMD, they can point you to a place on your dashboard that you can download that information as to find out new requirements. So make sure that you are understanding those as well. And then they've added some new improvement activities as well to go on to that. Performance metric report, as well as Medicaid. These are the Medicaid requirements, so some of them are a little bit different than what we've seen before, and this is a link to that information there. So so if you weren't real familiar with that, you want to make sure that you get familiar with what's required on there. And like I said, we have the reporting information in there already with the certification, as well as you should be able to start seeing that even now if you haven't upgraded. All right, so the upcoming Lunch and Learn sessions, February 6th, we will start doing a deeper dive into enterprise. So I want to start going further so that you guys feel much more comfortable going into it. If you have questions, that kind of stuff, just feel free to email me on that, and if I need to incorporate something to that extent or get it addressed. And then February 20th, I want to continue doing that. And then, like I said, March 6th, we'll talk about MIPS and PI reporting. And then to be determined are dates that I'm going to open up to be able to do more webinars on this. So I don't have the exact dates of when that's going to happen, but we'll go ahead and get those published out to you as they come in, so that we have much more than every other week of information going on that. All right. So Cameron, there's about a couple minutes left on this. I think we'll go ahead, just since I didn't have any panelists today, then we'll go ahead, as long as your questions were sent with an email or somebody that you and I chat often and I know who you are, then I will go ahead and go through that list of questions and I will get back with you. If not fully today, it'll maybe tomorrow, because I'm kind of back to back on meetings throughout today, but I'll try to get back with you by the end of tomorrow. All right?
All right, thank you so much, Susie. And yes, there were several questions, and what I can do is I can match up the email addresses to the attendees. If you didn't get a chance to get your email address in, and I'll get these over to Susie, and she will certainly answer all of those for you. And there will be a recorded, since this was recorded, everything will be sent to attendees via email after this meeting at a later time, and you'll get the slides at that point as well. But we definitely appreciate you being here today, and thank you, Susie, for a great presentation.
Thank you. Thanks, everybody, for joining. Have a good afternoon.